excellent information from the tight ends. Let's go to some wide receivers, specifically a couple of banged up wide receivers and their high enders. It's time for the Fairview Fantasy Rehab with Dr. Grant Morrison. Paul Charchian is standing by with the good doctor to take a look at a couple of high-end injuries. Jordy Nelson and Kelvin Benjamin.
Yeah, these are very tough injuries to some hallmark fantasy players. Dr. Morrison, thank you for joining us again. Both of these guys suffered ACL injuries on non-contact plays. You know, they're just running routes and they crumple. And so oftentimes when we do see this happen, it ends up being really severe. It ends up being the torn ACL. It's not a sprain. It's not something minor. It's torn ACL. What is it about non-contact plays that end up having such catastrophic results?
It's truly amazing to think about how the body can literally tear itself apart with nobody touching him.
Yeah.
With Adrian Peterson's injury, he got hit in the side of the knee. You can imagine somebody getting a catastrophic injury that way.
Right.
But when it happens in the middle of the field and nobody's near them, it's astounding. And what we think is going on is it comes down to physics. It's muscle imbalances. It's the quad muscle being stronger than the hamstring muscle. It's the rotation of the knee compared to the hip. These physics factors all come into play, and the body can literally tear itself apart because of these muscle imbalances and the physics involved.
Now, one thing we do see with the non-contact injuries, it seems like you don't get the PCL, MCL, ACL devastation that you would get, like in a Dante Culpepper situation. That it seems like it's only one tear in the non-contact. Do you think that's common?
I do, because of the physics involved. There isn't the contact, the hit, and there's just the forces pulling the knee apart.
Okay, so at least there's that anyway. We'll keep our eyes peeled for other non-contact injuries and hope there aren't many and as many torn ACLs, but obviously something that we're always watching, and you always get worried when you see the player just crumple. It seems like it's more often than not, it's the old ACL.
Who knows, for the Carolina Panthers,